Okay, good morning, everyone. Thank you so much for joining us. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative, and we are here doing the first in a series of events titled Career Pathway Programs Across the Nation. Today, we're going to hear from Ohio State University physicians and Stepful, a training provider. They are doing some really interesting things to address their medical assistant shortage and to provide their existing employees with opportunities to advance. Please introduce yourself in the chat so we know who's in the room. Today's event is recorded, and I will send out the recording and the slides to everyone who is registered tomorrow. I'll also send them out in a newsletter next week, and they'll be posted on our website. You can always find our recordings posted on our website and our slides in case you need to leave early or if you'd like to share with a colleague. So for anyone who doesn't know, the Chicagoland Healthcare Workforce Collaborative is an employer-led table that unites employers with industry partners to support an inclusive healthcare workforce by providing accessibility for underemployed and unemployed populations, while addressing the ever-evolving and growing needs for talent in our sector. We do this by focusing on local and targeted hiring strategies, by bridging the gap between our education and training providers and our employers, and by strengthening retention and career pathways. We talk a lot about our need to offer opportunities for our frontline employees to advance through career pathways into higher paying, wealth building roles. And so that's something that we are focusing on with this learning series. This gives you an idea of some of our hospital systems at the table. 6 of these also sit on our steering committee, and I see some of them here today. Thanks for joining. We are also supported by a myriad of strategic partners, including our community colleges and training providers in the region, community organizations, funders, advocates, and others. Anyone who is interested in this mission, who is doing healthcare workforce development and building an inclusive healthcare workforce, is welcome to attend our events and our quarterly meetings. So I encourage you to share these things with your partners. Speaking of which, we have a quarterly meeting coming up. This is an in-person quarterly meeting, so it's a great opportunity to do some networking and make some connections. It'll be on Tuesday, September 17th from 8:30 to 10 a.m. I encourage you to come around 8 so that you can grab some breakfast and do some networking, because we will start promptly at 8:30. This meeting will be focused almost entirely on our Good Jobs Challenge grant. That is a large grant out of the Economic Development Administration that we are a part of. Through that grant, we have built a nursing assistant training hub where we'll be training almost 300 nursing assistants and patient care techs before the end of the grant period next September. So we have 5 different hospital systems working on that grant. They've each created their own training model, utilizing 4 different training providers. And all of those models offer supportive services and career counseling. So we'll have an employer panel and a training provider panel at that meeting, so you can hear about what they're doing, hear what's working well, what our plans are over the next year, and also help us strategize on some of our challenges. You'll briefly hear about our Career Pathways Advisory Group, which is a group of former nursing assistants and patient care techs that we're bringing together to be guest speakers and provide a little bit of a mentorship role for these trainees. And we'll also spend some time talking about our efforts to upskill current nursing assistants. Some of this grant money is going towards career advancement for existing patient care techs. And we are hoping that that programming sparks some longer term programming that we'll talk about at that meeting. So I'm going to drop the registration link for that meeting in the chat. It's very simple. I just want to know who's coming, and I'll be making you a name tag. So please register, and just drop that in now. Back to today. So today, as I mentioned, is the first in a series of Zoom events that will take place this fall and into next year. It's our Career Pathway Programs Across the Nation series. So we've spent a lot of time in our table talking about what each other is doing and making connections between our systems in Chicagoland, learning from our best practices and our different programs. But there's a lot that's happening outside of this region that might not be happening in Chicago yet. So there's a lot to learn from others. All healthcare employers across the nation are dealing with talent shortages and are thinking about how can we partner with training providers in different ways? How can we support our existing employees to train to become to fill our in need talent areas? And I am excited to introduce Carl Maddie to introduce the our topic today and our speaker from Ohio State Physicians. Carl, you can share your screen at any time. But Carl is the Chief Executive Officer and co-founder of Stepful, a school that focuses on allied health programs for working adults. Stepful partners with leading health systems to build flexible online and hybrid training models, including outside-in hiring policies like apprenticeships, as well as inside-up career pathways and upskilling. Stepful has transformed healthcare training by developing an accessible learning experience tailored for today's adult learners, especially those from underserved communities. They currently have 8,000 students nationally training in programs such as medical assisting, pharmacy tech, surge tech, and LPN. So I'll pass it off to you, Carl. So happy to have you here today. And I'll also mention that Carl and his team have been working with some of our Chicago employers already. So I'm excited to see where that partnership goes as well. Take it away, Carl.
April, thank you so much for the introduction and thank you for inviting us to this panel. We're very excited to be here. Um, April, you mentioned something about wealth building, and I love that term because it really aligns well with what we're trying to do. So Stepful is a training program that wants to build wealth. We want to create pathways and opportunities for people to get good jobs in healthcare and keep growing. So I'm excited to talk more about that. So today I'm joined with Stacy from Ohio State University Physicians. Stacy is the HR director there. She's an amazing partner of Stepful. So I want to, maybe Stacy, you can introduce yourself.
Yes. Are you able to hear me? Sorry, I was having some trouble with my microphone.
Yes.
Hello, everyone. My name is Stacy Russell. I am HR Director at OSU Physicians. I've been with OSUP for 23 years and have seen the rise and fall of our MA programs in the Central Ohio area and have been struggling to fill MA positions and clinical positions for many years. So I'm right there with you and excited to talk with you about Stepful and where we've been able to take our recruitment and upskilling for last year.
Awesome. Stacy, thank you so much for being here. We appreciate your partnership and your trust. So for today, we're going to go over the agenda. Then we're going to talk more in depth about OSUP and Stepful. Then we're going to really go down with the details to talk about how to shape career pathway programs. And then we're going to leave some time at the end for Q&A. But please, this is a dynamic session. So if you have any questions, feel free to include them in the Zoom and we can answer them as they go. So don't keep your questions towards the end. Just please interrupt us and we would love to answer them. Great. Okay, cool. So what are the objectives of this session? So by the end of this session, I'm hoping to do a couple of things. One, we want to discuss innovative approaches for attracting and retaining diverse talent. Two, we want to talk about specific strategies on how we can eliminate barriers to get people from underserved communities access to training and access to certification. And then we want to talk about gain insights into practical solutions to prepare entry-level healthcare employees to get more clinical roles and to advance in their roles. To April's point, how can we kind of build wealth, build this career to kind of create that environment? And it's very important to note, we're going to talk more about kind of how are we shaping the training for it, so for it to work for the individual, so for the worker, for the person from the underserved community, but also how will it work for the organization? So what organizations should be looking for while thinking about who to partner with? Great. By the way, if you have any questions, just please put it in the chat. So let's talk more about OSUP and the Stepful partnership. So we're going to start with OSUP. Stacy, do you want to tell us more about OSUP?
Yeah, absolutely. So in the Central Ohio area, we have three big medical centers, ours being the OSU Wexner Medical Center that's affiliated with the Ohio State University. We have about 1,800 employees, and if you had asked me a year ago, I would have said 1,500, and the year prior to that, I would have said 1,100. So our market continues to grow at the same time that we're having shortages. Our affiliation with the Wexner Medical Center is that we run and operate all of the outpatient care centers. So we have in the academic environment, the hospital, we have research and education, and then we also have the outpatient clinical mission and the outpatient arm of the medical center. We are a separate private employer from Ohio State. So that's one of the distinctions, one of our challenges, and one of our wins as well. Is we're smaller, we're more nimble, we're a different type of organization than the university and the Wexner Medical Center. So we partner with our physicians at Ohio State to deliver patient cares in our communities. We continue to grow, as I said, we're expanding patient access in our primary care space. We have different companies too. I have 5 different companies at OSU Physicians. So we also expand into providing MSO services. We have a joint venture with emergency medicine providers in all of our rural hospital centers in around Ohio. We also have what we're calling our community practice, where we are one step further removed from the academic practice. Some of you may understand that work in the academic medical environment, that the doctors generally have like an appointment where they do research, they teach, and they see patients. So we're developing clinics that are just patient care for the person. So just continuing to grow. We have a mission to hire another 350 doctors in the next couple of years. So got to meet the demand of a growing market. Columbus is the fastest growing city in the United States right now. So.
Stacy, I didn't realize it's growing so quickly. It's incredible. Wow. So it's almost doubling in size. Like you started 3 years ago with 1,100. That's crazy. Wow. Yeah. Very cool.
A lot to keep up with. You asked me about numbers. Like, I don't know where we are today. I better pull that up. So, yes.
I love it. Okay, great. Thank you, Stacy. Cool. And on the Stepful side, so as April mentioned, Stepful is primarily a school. We're a training program, and we have a mission to empower communities to get access to healthcare careers. And the idea is we want to eliminate any barriers they might have in order to access these careers. Because as Stacy mentioned, there's a huge need for these workers, and it's going to keep growing. It's not going to stagnate in the next couple of years. So how can we leverage a population that has been underserved, that hasn't been able to get access to these careers? So to date, our students are typically 93% women, 90% Black and Latinx, and 88% low income. And if you ask me, why, Carl, are you starting with your mission? Why is it important? Because that's how we deliver the program. The program is all about how can we get this community into getting healthcare jobs. And when I talk more about the training, you'll understand how we incorporate it in our teaching methodology. So Stepful is a platform. We are a tech company as well. So our program is an application on the phone. It's a tech product, and you can access it on your mobile and on your desktop. And that's super important because a lot of the communities that we work with don't have a desktop to access the learning experience from. So that's first and foremost. Second, even though our program is online, it does not mean that they're doing a self-paced program. There is an instructor who's there. They're giving 1 or 2 sessions per week, and they are making sure that students are understanding the material and are understanding and are getting the competencies required. Third, I don't know about you, but everyone's on TikTok and Instagram. So it's very difficult to kind of get their attention away from that. But that's why we create engaging content. So all of our content is generated by Stepful, and it's built in a way that it's like 2 to 4 minutes long. And then it's very engaging. So students can engage with it. And then after each module, they can complete assignments or quizzes or virtual simulations. And then there's an aspect of community learning. Learning is a lonely endeavor, and a lot of the communities we train, and frankly anyone, whenever you're going through a program, you're very likely to leave. Life gets in the way, a sick parent, your child needs you, um, you don't feel you're good enough. So really we want to empower the students to learn in communities, and that's why we focus a lot on that aspect. And then lastly, which is the most important part of our training, every student gets a coach. Every single student gets a coach and makes sure that the student is showing up to class, is completing their assignments, is completing their clinical labs. So this is super important because that makes sure that the student is also going to graduate on time. So you have to think about us as a comprehensive training solution that works for the adult learner. And Phoenix Silverlight asked me, how do you build community and implement community learning? That's a great question. So a very practical solution, for instance, is we create group projects throughout the learning experience where students at a specific time convene online and walk through simulations or patient medical assistant scenarios that are then recorded, and then the instructor grades them afterwards. Or for instance, we have a chat group where students for extra assignments have to show how they're completing a specific procedure. So these are ways for us to empower the community learning. And it all happens at scale. We have around 10,000 monthly active students this month. So we do it at scale. Another important thing is this training is designed to work for the adult learner, which means it's flexible. So for some healthcare systems want the employees to do it outside of their productive time. So that's how we schedule it. Other employees want to integrate it in their working time, so we can do that. So there's a lot of flexibility for the training. And if people miss out, everything is recorded. So it's a very dynamic training. So this is a bit on the learning platform. What does it mean? And that's what you should care about, to be frank. I feel people don't talk enough about that, is you need to look at the outcomes of the training. So our completion rates are 90%. That's twice the rate of any alternative program that we see. And that's extremely important because you're paying sometimes for that training. So you want that training to be high quality. The second thing is our certification rate. Our national certification rate is 85%. The national average is typically around 70. And then third, it's much quicker than most trade schools and community colleges, just because we designed it in a way to be very effective in how we deliver the content. And to be frank, you want the skills to be built in a quicker way without sacrificing quality. So we tend to, like our medical assistant program tends to be around 4-month long part-time. So these are the attributes of the program. Now, how does this work in a practical level? It's great, but how does it fit with healthcare employers? How are we making sure we're building the skills for the healthcare employers? So there are 3 ways we work with employers. One is what we call community partnerships, where we identify local students aligned to your needs, and we facilitate a sponsored externship because we are a school, so we have students that are not attached to a healthcare system. And then we have two other methods which are more attached to the healthcare system. So one is either an apprenticeship or train to hire, which we're going to cover today with Stacy. But this is where we help you set up an earn while you learn program, where you attract external applicants without healthcare experience to get into the door. And that's extremely powerful because essentially you're going to be able to go to your community, hire people who did not have access to education and get them in. And then the second thing is upskilling. So how can we get the people you currently have, like your EVS staff, the people on nutrition, to become clinical? Or how can you get your medical assistant to become a practical nurse? So these are all strategies that we can work that will help you solve two pain points. One, it will help you fill critical job vacancies, which are, to Stacey's point, are going to keep growing. And then two, it helps with turnover because what happens is when you're getting that EVS worker to become a medical assistant, they're more likely to stay. When you're getting that medical assistant to become LPN, you're more likely to stay. So these are the three ways we work with organization. Today, for this talk, we're going to focus on the train to hire apprenticeship and the upskilling, because these are going to be relevant for OSU. Cool. So now that we spoke about it, let's talk more about how we work with OSU. So OSUP has a goal, two specific goals. One, which is filling the medical assistant vacancies across their outpatient care centers. And second, how can we improving the retention of these medical assistants to for them to kind of limit the vacancies they have down the line. So the methods we spoke about are, we're going to talk about our train to hire and upskilling. And really, if you want to think about the capacity or the magnitude, our goal is to fill around 10 medical assistant vacancies per month. So this is high level what we're going to talk about. So Stacy, can you tell us more a bit about kind of the problem you have at hand and the challenges you have?
Absolutely. So the majority of our workforce at OSUP, because we serve outpatient clinical facilities, are the medical assistants. So those are the lifeblood of our workforce. And we have today almost 400 MAs. Again, that's grown over the years. We've been hiring for these roles since I've started here. There used to be, I'd say like 10 years ago, a medical assisting school on every corner. And you had billboards advertising to go become a healthcare worker. And that goes for other healthcare positions as well, surge techs, STNAs. It's just, we need to get people excited about these careers again. Those schools have shut down. And we have found that through the COVID years and the Great Resignation and our hiring needs, that we continue to fish in the same pond with the same people, the same candidates. And we're just recycling the same people over and over again. So our challenges have been, how do we get new talent? How do we get people interested in healthcare careers, which is a lot of this, what you're doing in Chicago with your collective. We're starting to do that in Central Ohio. So it's drumming up that excitement with kids and all K through 12, getting them excited. So there's that initiative, which takes years to accomplish. I mean, we can't get that 12-year-old in the door now. But what do we do now where we had 60% turnover in the first year of our medical assistants in 2023? We were at 50% vacancy rates in some of our clinics. We were getting phone calls from physicians. I can't run clinics safely. I need people now. Temp agencies aren't what they used to be in our organizations because we have electronic medical records that require training, and we can't just plug people in like we used to. So we're meeting all of these challenges with coming out of the pandemic. Everyone wants to work from home. You can make $20 an hour working at Amazon right down the road or at McDonald's, and I only pay $15 an hour for a medical assistant that requires, a diploma. Maybe they need a year or two of education. So this was all coming to a head at the same time that Stepful came forward in front of us, and it was like almost this perfect relationship match of we want to find people for you and source, and we can train, and we can get them in the door, and they're an untapped market. And it's like, this is too good to be true. So that was kind of what all came to a head last year, was high turnover, high vacancy rates, a burnout workforce, burnout trainers. Managers didn't want to recruit or hire anymore. We were all just, what do? We can't just keep throwing money at this problem. We need to hire people, keep them. And we needed a solution where we were.
Got it. Thank you, Stacy, for outlining the problem. It's interesting, the concept of competing for the same talent. Like we see more and more people kind of decreasing travel nursing or temporary staffing just because it's so high, and instead you're just moving the exact same talent. And that's kind of a very important concept, is how can we build the talent instead of just reassigning it from one healthcare system to the other. Cool. Let's go on. Stacy, do you want to tell us a bit about how you're partnering with us?
Absolutely, yes. One thing that I really like about Stepful and working with Carl and his team is it's very customizable. It's almost like we share what our challenges are, and Carl and his team have designed programs that fit our needs. Like I said, we were struggling with hiring and finding new talent to come into our workforce. So that's where we started, was on the train to hire. We started small scope. We started with just a couple of our clinics that had really high vacancy rates, and we were trying to fill in those spots with somebody that was new and had that excitement to come in and do the work, wasn't burnout yet, if you will. And then we grew from there, and looking at some of our people that we had trained to hire. We tried to do this ourselves, and it was very hard to scale. We didn't have the workforce to train up in-house those that wanted to become clinical employees. We did, though, bring in a few people that had some clinical background and get them in the door, and we gave them hands-on training, but they did not ever have that formal education. So we worked with Carl and his team to upskill them and give them the training they needed so they could sit for their certification exam and continue to invest in our workforce. At the same time, we were bringing in new people.
Thanks, Stacey. And when you were thinking, I know you mentioned like you were trying in-house solutions. I know you mentioned a bit about temporary staffing, but then you had to train them on the EMR. Like what other solutions were you considering, and like how did you end up choosing, like falling on Stepful and choosing Stepful, I would say?
So we had very stringent qualification requirements for our frontline clinical staff. We required a diploma for many years, and that evolved as we were looking for new talent in the workforce, and schools that offered diplomas started to dwindle down in our area. So we had an opportunity to offer up the MA position to EMTs, STNAs, someone who went to nursing school but didn't finish the program. So they had some clinical training or education. And we developed what we called the medical assistant training program. And we hired one trainer to help bring them in and get them, fill in that gap and upskill them to the point where we needed them to be, which is like giving injections and passing medications and doing more of the full scope of a medical assistant in our area. Well, that program was hard to sustain because we just didn't have, first of all, the sourcing. Where do we find this talent? Second of all, having the number of trainers and the education capacity to be able to bring in enough to fill all of our vacancies. So it was a good step, but it wasn't the final stage. Stepful came to us through our Senior Director of Recruitment and Talent Acquisition at Ohio State. He sent us Carl's information and we were like, great, let's talk. And a couple of things right away that we noticed was how, I don't want to say short the training is, but it's compact in the amount of time that you can get somebody up to speed, get them the skill set that they need, and the externship piece was very attractive to us. So we have been pitched an apprenticeship program through the state of Ohio, and that program was 1.5 to 2 years long. We need talent now. So the speed in which they can get people up to speed and in the door and on the ground working was very attractive to us. We also had our nurse educators and our safety and compliance team sit in on some of the classes to see what the delivery was and understand, the quality of the training from their educators. And Carl and his team were very open to opening the door to us and showing us everything. And they had a really good comfort after sitting through some of the courses, the training, and the quality that they were getting as well. So it's a great start.
Awesome. Thank you, Stacy. I think if I'm hearing correctly what you're saying, I think one aspect is kind of building talent from scratch is important, right? You don't want to recycle the talent. Second, when you looked at Stepful, you cared a lot about the quality of the training, right? That's when you mentioned that there's educator and the outcomes. Obviously, you want them to pass the certification. So that's second. Third, you touched on a bit on ops load. You said that you tried an in-house solution, but it was ops heavy. I feel like whenever I have a conversation with the health system, like what is the impact on ops? Like our staff is overworked, we don't have receptors. Like how did you approach that problem? Especially that you said in HR, there are people on the clinic level that have pushback. Like, can you walk me through how did you make the case to kind of, because you're managing multiple stakeholders, to convince them to work on that solution or to partner with us?
We were spinning our wheels for a long time trying to figure out how we could do this ourselves. And this solution came to us and it just seemed like such a great fit for what our needs were that we had already spent funding on retention bonuses and various things to try to keep our staff, that we had the ROI to share, that with the churn and burn from losing all of these people that we're trying to retain paid for itself. And our compliance team, which is our nursing educators, and our recruiting team were quickly on board with just the idea of having another pipeline of talent coming in, and very open to hearing more and learning. I think I was probably more on the conservative, cautious side, where everyone else is running full steam, and that's just my nature. Like I want to see how things work, and I'm fully in. It's been an exciting change over the last year to see this pipeline open up for us, and these skilled MAs come in the door. And our burden as an operations team is not in the education and the initial training. It's in the externship, which is really a great on the job interview time as well. And you get to use that time to evaluate their skills and show them how we do things here. So it really was a win-win for us.
Absolutely. And Stacy, there's a question in the chat about in-person clinical hour requirements and how we navigate that. I think there are kind of two embedded questions. Phoenix, if I'm pronouncing your name correctly, correct me if I'm wrong, but one aspect, does the program require externships? The short answer is yes. Typically, it's around 80 hours. And it's a competency-based externship, but they still need to complete the hours. Stepful does have a checklist and does help with kind of making sure preceptors know what they need to do, and making sure we're uploading that to the system to upload. Now, there are some exceptions. If people have been in clinical roles and have done these competencies before, there's a way to waive that. So that's kind of on the requirements. Now, how Stepful navigates it, And Stacy, I know we spoke a lot about it. I know preceptor scarcity is a big problem. Like, how are you going about that? I know that's like a very common objection I have from a lot of the calls.
Mhm.
Um,
Yeah.
can you tell me more about that? And just before you start, Phoenix, to your question, you do not have a formal clinical hours that does you don't need to have a clinical instructor to do the clinical hours. You need to have a preceptor, and Stacey is going to talk to us about this right now.
Yeah. So we do have a shortage of preceptors. We are about 60% of where we need to be. But we have to find a way to get these MAs in the door. So we have what we call central hiring for this group of this population for our medical assistants. So that has streamlined our hiring of all of our medical assistants by one party, I guess, if you will. And it streamlined our training and our onboarding process. So we have one central contact for all of our MA hiring and training and onboarding. And he is involved in all of the interviewing of our Stepful candidates and MAs that come in through central hire. So these MAs would need to go through a period of training and onboarding anyway. It just adds an additional 2 weeks to the 4-week training period that we have. So what we've done is we've worked out with Stepful that at the time that we hire them and we start paying them as employees at the start of their externship. So when they come in, it's really an extension of their training. So they come in as an employee, they go through their externship for 2 weeks, and then they complete their 4 weeks of training in-house. And central hire is set up that they do rotations. So they get to see all of the clinics and do these working interviews with various preceptors so that they're not overwhelmed or burnt out on just training all day, every day. We try to spread it out.
Cool. And building a bit on what Stacey's saying, I know online training typically scares some folks. Like, are they training? Are they getting the right competencies? How can they go about it? I think there are two pieces to this question. One, during the didactic component of the training, there's quite a bit of skills that they do. So students do skills at home, they get recorded, and then the instructor actually has to sign off on these skills. But also you have these simulations that help them. And then we help work on the preceptors and making sure that with OSU, we're thinking about doing preceptor training, but we do think about different ways to standardize that training on the job with the competencies, with the preceptor training, and with a bit of technology to kind of take that information from preceptors and make it as lean as possible. Stacey, I want to move on to results because I think that's very exciting. And I'm sure it was, yeah, let's go through results. So do you want to walk us through a bit the program impact and how you think by the way, people don't know, but Stacey has like one of the more advanced ROI models we've seen. So thank you for doing that. Sam, you have a question before we start?
Yeah, I just wanted to flag, Shonda had asked in the chat about compensation structures and when employees go through upskilling, do they get additional compensation once they receive certification? So I thought it might be helpful to add that to.
Yes,
Awesome.
so around the same time when we started to engage with Stepful, we introduced a medical assisting career ladder program. So we have the MA level, and we have a senior MA, which is where they can take on additional roles within their clinic, like lab champion, safety champion. And then we have a step for certified and a step for lead. They get a 5% increase at each level. So we think that in line with getting our hiring needs taken care of, filling some of these vacancies and also meeting their needs of investment in themselves has helped with our retention. So see these numbers are like, we're really excited that we've been able to reduce our first year turnover. We've reduced our vacancy rate we were at 14% vacancy, now we're down to 8%. And our monthly vacancies, they continue to fluctuate because we're adding new positions. each month as we're opening new clinics. But yeah, we've been averaging 50, where now we're averaging between 20 and 30 vacancies at any given time. We've actually had a good problem, Carl. You were sending us too many people, and we had to say stop. We couldn't interview that many. We had capacity issues, and we had to kind of slow things down. So we've gone from 5 a month to 10. We've doubled how many we're bringing in from our Stepful hires. So
Yeah.
it's a good problem to have.
Yeah, I think so. And Stacy, that's a great point. Especially, I know there are DEI leaders in the chat. And I think that's kind of what people sometimes forget is if you want to hire from your community, people who have medical assistant certificates, it's a very small number. But once you say, I actually can hire anyone from the community and then train them, then suddenly the volume becomes much larger and you're able to fill the roles that have been unfilled. And then the second question, the second part is retention, right? Everyone's talking about turnover, turnover, turnover. So I think to your point on kind of making sure we're very deliberate on how you're designing the salaries and how we're kind of looking at the pathways coming after medical assistant, we're going to talk about it shortly. These are all important parts of improving retention or turnover. Cool. Maybe, yeah. Sorry, yeah. Let's talk a bit about the future.
Mhm.
So, Stacy, before we get there, can you share with us a bit of student testimonials? Like, what are people saying about the the learning experience?
Oh, they love it. So I talked with 2 of our MAs that went through upskilling. So they were people that we trained to become medical assistants, but they did not have the formal education to become certified. So we offered them the opportunity to go through the upskilling program. We had 8 that went through the full program, the Stepful. They liked the personalized attention that they got. They had a coach that would call them on a regular basis and talk them through. They said, one of them said that you'd really have to try hard to fail because you're really given a lot of opportunity to learn and practice. There's group projects that they work on that was unexpected for me, like that they actually work as a group after the class to learn together. Feels a lot like a university environment. It also, from a personal level for them, fit into their career progression where they wanted to go. They just were hungry for more information, and they felt like it helped them do their jobs. Like they all learned something that they didn't know before, even though they were already working as MAs. There were a lot of things that they picked up on.
Thank you for sharing, Stacy. And I think this is our hope, is that we really are with them every step of the way. And the fact that your students feel that, it means that at least part of our mission is being accomplished. So talk to us a bit about the future. So now you're kind of trying to fill some vacancies. Sometimes you're getting more people than you need. And now you have a lot of medical assistants that you want to make sure they don't leave. So can you talk to us a bit about how you're thinking about the future and how we're expanding our collaboration?
Absolutely. The word is out that we have a partnership with Stepful, and my partner Lori in compliance and I get emails weekly from staff and managers. How can I get so-and-so involved? So-and-so wants to become an LPN, so-and-so wants to become an RN or get their certification. So we're looking at the next level. What else can we do? Our environment, we have over 200 of our medical assistants are not currently certified, but they already have the work experience or the education that they could potentially sit for the exam. So rather than send them through the full program, we worked with Carl's team to develop a program specific to us that is just for preparation for the CCMA exam. So like a certification preparation course. So we are working on that right now. I have 45 or so medical assistants that have expressed interest in just going through a program to get themselves back in the game, if you will, and ready to sit for an exam. So we're really excited. That should launch in November, early November, late October. And then we're currently piloting, we have 8, I want to say, MAs that want to become LPNs, and we are sponsoring them through an MA to LPN upskilling program. So LPNs are very hard for us to fill as well. So much so that we have managers that say, I'm going to replace my LPN with an MA because I can't find one. So we've dwindled down as far as how many LPNs we have in our workforce, which have a greater scope of practice. And this will hopefully open up them with the ability to use these staff members in a greater way within their clinics.
Thank you, Stacey. And Stacey, there is a question in the chat talking about retention. Dana asked, is there a commitment requirement from the apprentice? Like, are you asking them to stay a specific amount of time? Like, for instance, for the upskilling, like when you're upskilling the medical assistants or the LPNs, like what kind of time commitment are you putting in place?
We have not put in a time frame. We feel that best practice is to put in a time frame. We just wanted to get through a pilot program, see how it went, collect the feedback, get our ROI, and then put together like how we wanted to manage this for the future. Because right now we're doing this more as a tuition assistance. We're sponsoring them through the program, but we also have a tuition reimbursement program, which we do not require a retention period for either because they're fronting the money for the education. So we have not gotten to that point in this relationship to decide, do we want to put that in? But the LPN one after the pilot, we will require likely 2 years of commitment if we sponsor them through that upskilling.
Yeah. And when we advise teams on that, we typically advise them to put a commitment. We see it helps. So yeah, so I think I also thought there are some questions about LPN and education. It depends on the states. Some states we have the ability to do our own LPN program, and some states we partner. So it really depends on the states we're looking for. Cool. Best practices. Okay, I know we have 12 minutes left. April, do you need more time at the end? Because I want Q&A as well, so I can know how to
I don't need time for anything. I'm so glad to see that there's so much interest and so many questions. So
awesome. Cool. We're gonna quickly go through 2 or 3 slides, and I'm gonna stop 5 minutes before for the final Q&As. But really the idea here is we want to help you think about best practices when you're evaluating career pathways. The first thing that when you think about building a career pathway is you typically have 3 buckets of learning. You have the community college partnerships and trade school partnerships. You have self-paced online programs, and then you have system-run programs as well. And Stacey mentioned that a bit. Typically, what we see is community colleges are great, but they don't have the capability or the scalability to fill all the roles you need to be filled. So there's a cap on how many people they can train. So that typically acts a bit like you need something to complement that. There are a lot of self-paced online programs, and they're very scalable in nature, but the reality is outcomes are not there. So we see typically graduation rates to be between 10 and 15%, so very low for what you would want as an employer. And then system run programs are amazing because quality tends to be very high, but it's a huge cost, right? Because you're essentially delivering care to patients and building a training program. So it requires a lot of efforts. Sam?
Yeah. Hey, I saw, I think it was Dina in the chat had asked about speaking to hiring managers' role in the interview process and hiring process. And I thought that might be relevant to like some of the ops challenges that we see with system run upskill programs.
Yes, exactly.
Really
To speak to how, okay, yeah, go ahead, Stacey.
So it might vary depending on your organization, but when we first started, we did have this manager-led and clinic-led. And unfortunately it took a lot more time. and they were very selective. So we did not have the outcomes or results that we were looking for until we switched to a central hire model where we had everyone go through one hiring manager, make the selections that are best for the organization, and then put them into our central hire pool so that they could be part of this rotation and float around, meet the different managers that way. Like we needed to get this done more quickly. You're probably feeling that pressure too from your workforce or from your managers. And it's like they take their time and they do a lot of interviews. So we took that from them cautiously.
Thank you, Stacy. Can I ask another question, a follow-up question to that? Do you encounter times where you have managers requesting specific MAs and they'll stay in the department for maybe 6 months or longer? Or are they in the department for a short period of time typically?
So we have two different setups. We have central hire, which is the ones that go out and they can be selected to be hired directly into a clinic. And then we have a float pool that fills in for vacancies. So they would go into one or the other, and we would expect if a clinic manager selected a central hire, that it would be a permanent placement, that they would stay there.
Got it. Great model. Thank you.
Cool. I'm gonna end. So I'm gonna just do one more slide and then we'll move to Q&A. I just think like whenever I think for us, what we want kind of just to make sure we understand, because barriers are so important for this call, is to understand the barriers for getting people trained. And I think when you are evaluating learning platforms or programs or how you think about structuring, you need to always think about the cost to the student. And we see kind of OSUP does very well with paying upfront for some of the tuition and covering the tuition for most of the programs. Second, accessibility for adult workers. So it's when you're evaluating training providers or any type of program, just make sure it works for your worker. Because if you're a single mother and you're working the whole day as an MA and you need to go to class at night, being mobile matters. To have some type of curriculum that they can do on their own time matters. So really think about flexibility for the working adult. And then third, think about support. Like this is a very difficult thing to ask people. So we just push our partners to think about how can we provide the right support that is important. And Phoenix, to your question on the one-on-one coaching time, it really depends on the student. Some students fly through the program and need very limited support, and some students need an hour or 2 hours per week. So really it ranges, and it ranges. Another thing I think for us that we kind of why we're here and why we want to talk about is when we built our program, we built it so it works for the working adult and for the employer. So that's why we help a lot with the operations. So we take the ops away from the system and we work with the hiring managers, we work with the clinics for externships, and we have a tech layer that helps us do it efficiently. As you see with Stacy and OSUP, it's a scalable program, right? We're filling 10 on average per month. That's 120 openings per year. That's a substantial number. We have leading outcomes because we make it for working for the adult learner. And then we do a lot of work on preceptor to standardize the preceptor training and the outcomes. And then we are a tech layer, so we do focus a lot on data. And to Phoenix's question, which we were able to predict if students are gonna be inactive, and if they're gonna be inactive, and act accordingly. I think there are two questions. Phoenix, I think it's the second time you ask about ROI data for Stepful hires specifically. The data we mentioned on the presentation is for Stepful hires. And typically we have other partners and we're happy to show you other case studies, but we typically see an improvement between 70 and 80% in turnover. Can you talk a bit more about the time commitment needed for the participants? How this can work with. So the whole point is it's around 2 hours per day of work. that we expect participants. There are 2 lectures per week that are mandatory and that are recorded if someone wants to skip, but then it's around 2 hours, and the work is very engaging. It's these engaging videos, simulations that we see. Cool. I'm going to stop here because I know there are some more questions. So I'm going to, yeah, Sam, I'm going to just share my, yeah, Sam, do you want to go ahead?
Yeah, sure. I wanted to share this with Joanne and then kind of get folks' feedback. But one of the things that we know is important for optimal flexibility is we offer our classes for many of our programs 6 times throughout the course of the day. So like depending on the program and if you're able to give employees time during their working schedules, or if you can't, which is more likely, there's a lot of flexibility on if they're taking an early morning class, an evening, a nighttime class. The other piece is we've really strived to move away from like a traditional semester schedule that we know is one of the challenges of many of our beloved local education institutes. So we open new cohorts for many of our programs every 3 to 4 weeks. So if it's a good fit for 2 folks to enroll in the October MA cohort, great. And then another 2 can enroll in an evening cohort in November. There's that level of flexibility. So just wanted to clarify that.
I have a question while people are thinking of questions, and I have a final question for Stacy, but just for the people who are attending the webinar right now, can you put in the chat which allied healthcare roles are a strategic priority for your system right now? Like, what are the 2 or 3 most important roles you really need to fill? We're curious to see what are people saying. Wow. Interesting. A lot of CNAs, medical assistants, respiratory. Okay, pretty online. Rat tech, yeah. What's Paige? What's HCT?
Sorry, we use that terminology for our healthcare techs.
Okay, got it. Cool. As people are putting their allied healthcare role priorities, Stacy, we're coming towards the end, but is there any other words you would give for people who are trying to set up their programs? Like, what are things they need to think about, or any kind of final thoughts that you would like to share?
Yeah, absolutely. Be open to learning about new opportunities and different ways of learning and upskilling your workforce. Stepful has a lot of data-driven analysis that they can share with you on how they find talent, and it's very interesting at how you have a rubric that helps you find the talent and the candidates that can help fill your role. So if you're searching for another pipeline, yeah, keep the open mind about things. The world is changing.
Thank you. Thank you, Stacy. And by the way, thank you so much for your time. We appreciate your partnership, your trust, and your support. So thank you so much for making the time. I saw the program. This is pretty cool. This is what we're seeing in line. We have an amazing search. Like, we can talk more about these programs. So we'll probably, like, you can reach out to us if you want to talk. We have Search Tech, we have Pharma Tech, we have PCT, we have LPN in some markets. So happy to talk about it. We have CNA in some markets as well. So happy to chat about all of that with all of you. April, thank you so much for the opportunity to help us and to organize this. This is beautiful. To be honest, it's one of the most engaging sessions I've ever had. Like, the questions were amazing. So thank you so much for getting such a great group. April, I leave you for a final
Yes,
word.
thank you so much, Carl. I'm so pleased to see so much excitement and so much engagement. I'll reassure everyone that I will send the recording and this slide deck tomorrow, and I think maybe it'll just be easy for me to CC Sam. Thank you, huge to Sam. I think everyone could see that she's the behind the scenes answering everyone's questions, and she was integral into putting this together. So everyone can reach out with additional questions and to get your own meeting started. And a huge thank you to Stacy. I think it means a lot to everyone here to know that to hear it from you as a similar practitioner, as someone who is working in HR and healthcare and seeing the same needs that so many of us are seeing, and hearing about this partnership from your perspective was really, really valuable. So thank you all so much for your time. To everyone in CHWC, I hope to see you on September 17th for our in-person quarterly meeting. And also keep an eye on our newsletter because I will announce the next one of our career pathway programs across the nation series that will take place in October. Thanks again, everyone. Have a great rest of your day.
Thank you.
Thanks, April. Thank you, everyone. Thanks, Stacy.
Thank you.